Hello, my name is Paige R, and this is my digital story. The most important pieces of information that I took out of HS410 was the definition of an elder. An elder is considered someone 65 or older. When people start to age, their health starts to decline. Because of this, they must learn how to adapt to changes around them. It was very educational to research death and dying because before my presentation I did not know much about it. I learned what physician-assisted suicide and euthanasia were. Physician-assisted suicide is legalized in 4 states. Another thing I learned was about fall prevention. This is the leading cause of unintentional injury and death in elderly. The most important topic that I took away from this presentation was that the elderly need to become more educated on prevention. Some ways that we can prevent falls are by increasing the elderly's strength. Help them understand how important it is to follow their medication directions. It is also important to have eyesight checked regularly and remove dangerous environmental hazards. I learned that there are an increased amount of adverse drug effects due to the increased number of prescriptions. Medication is a substance that treats, prevents, or reduces the symptoms or the progression of a disease. It is important that you have a plan for what happens if you were to get sick or die. Making sure your loved ones know and understand your wishes is extremely important. Avoiding and or resolving family issues during this process makes this difficult time a little easier on everyone. Another thing I learned was as a healthcare professional, it is important to think of a design structure. Since people in the healthcare facilities are suffering with some sort of illness, it is important that we make the setting as comfortable as possible. The patterns that we use must not be too busy. The types of flooring is also important. We want it to be a safe environment for everyone. How the room is laid out is essential to the comfort of the resident. The size of the room and the type of furniture used is beneficial to the health of the patient. The furniture and belonging in the room should give the patient a sense of home. Since the elderly have declining health, we as healthcare providers must stress the importance of physical activity. Starting young will decrease risks for disease, therefore living a healthier life by keeping bones and muscles strong. There are many things I can take from this class, but the main topics that I will take and apply to my career as a healthcare provider would be the importance of teamwork in the healthcare setting. Communication is a huge contributing factor to being an efficient healthcare provider. When dealing with the health of patients, there is no room for error. And last but not least, having patience is key. We might be faced with patients or families making decisions we may not agree with, but it is our responsibility to respect their decisions. Overall, I took a lot away from this Issues in Aging course, and I will apply it to my degree as a healthcare administrator.